Nous allons poursuivre avec le leadership infirmier et formation des étudiants en soins infirmiers, avec l'intervention de Suzan B. HASSMILLER, infirmière leader reconnue mondialement dans le domaine de la santé publique, de l'éducation et de la recherche, des politiques de santé et leadership infirmier. Elle est depuis 1997 dirigeante des stratégies infirmières et œuvrant pour l'équité en santé et l'amélioration des soins. Nous ne l'avons pas en présentiel, mais en distanciel. On peut lancer la vidéo, s'il vous plaît.
Thank you very much. I am so grateful to Dr. Christophe Thibault for inviting me to speak to you today. And I'm grateful to all of you for teaching tomorrow's nursing leaders. Your task is incredibly important for advancing health in France and beyond. I'm going to talk to you about the importance of developing leadership in the nursing profession, the characteristics future RNs will need to be successful leaders, and the strategies available to develop leadership competencies in undergraduates. France has many wonderful nurses, including Inès de Boudron, who served as president of the French Red Cross and established Red Cross nursing in Morocco. The Red Cross is near and dear to my heart. I began volunteering with the Red Cross in college after the organization helped me to locate my parents in Mexico City after an earthquake. During de Boudron's long career, she emphasized health promotion and prevention. She organized milk drops to promote nutrition. She started the first maternity center in Morocco and organized clinics in rural areas and started nurse training programs. Nurses throughout the world can learn from her example. The Commonwealth Fund is a U.S. philanthropy that promotes a high-performing, equitable healthcare system that achieves better access, improved quality, and greater efficiency, particularly for society's most vulnerable, including people of color, people with low income, and those who are uninsured. They profiled France and noted your country provides universal health care coverage and boasts of health outcomes among the best in the EU and the world. Your country, however, has identified health prevention and promotion as national priorities. Reducing disparities is also a goal. There's a need to improve coordination within your healthcare system. Nurses with strong leadership skills can help France to meet these goals. Nursing in France, like the United States, has often struggled for the recognition, appreciation, and development of the profession. Advanced practice nursing continues to need national strategies to support initiatives and ensure sustainability of these roles, which have enormous potential for promoting prevention, care coordination, and advancing health equity. Tomorrow's nurses, too, will need to be leaders. They will be required to provide high-quality, compassionate care, adapt to changing roles and responsibilities, coordinate care, promote prevention, be savvy with technology and artificial intelligence, work well in teams, communicate well, and form partnerships within and outside of healthcare to address the social factors affecting health, such as making sure people have access to healthful food, safe places to play outside, and public transportation. Nurses will need to advocate for changes to advance health. It's almost a superhero task, and developing leadership skills while nurses are students will be critical to enabling them to realize their full potential for transforming health. Leadership training needs to start in nursing school to prepare students to address the complex health challenges they will face on a daily basis and give them the necessary skills, including compassion, to advance health for everyone. And leadership skills in nursing are essential at every level, not just for the nurse leaders within the organization. They ensure the well-being of patients and the efficiency and effectiveness of healthcare systems. The U.S. National Academy of Medicine released a landmark report in 2010 calling on nurses to lead change to advance health. I am proud to say that I led the development and execution of this report. It was internationally renowned and served as a blueprint for reconceptualizing the role of nurses in transforming the healthcare system. The report offered recommendations to transform healthcare through nursing so all Americans have access to high-quality care, with nurses contributing to the full extent of their capabilities. The report reconceptualized roles for nurses so that nurses truly are leading change to advance health. The report called on nurses to develop their leadership skills. Since the report's release, schools of nursing and nursing organizations have underscored the skills nurses need to lead successfully. These skills are described on this slide. Communication skills. Communication skills are vital in nursing. Nurses often serve as the point of contact between the patient and the physician, and between the patient and their family members. Nurses must be able to communicate clearly and effectively to identify goals and expectations. They must also provide patients and family members with accurate and understandable information about their diagnosis, treatment plan, and expected outcomes. Critical thinking and decision making. Nurses working directly with patients often come to their supervisors or managers to discuss complex cases. Nurse leaders must be able to consider a variety of factors to come to a swift and evidence-based decision regarding patient care. Empathy and emotional intelligence. Empathy and compassion rest at the core of the nursing profession. Not only must a nurse leader be able to empathize with the way their patients are feeling, but they must also show compassion when guiding and mentoring the nurses who work for them. I always say that compassion and empathy separate a great nurse from just a good one. Adaptability and innovation. Flexibility is crucial for responding to new technologies, staffing challenges, and shifts in policy, ensuring team success. Innovation keeps an organization competitive and adaptive to change. Nurse leaders need to innovate and transform to improve quality, design new care delivery models, and create workplaces that empower nurses to advance new ideas that lead to innovation. Mentorship and development. Great leaders mentor their teams, offering guidance and growth opportunities, which strengthens both individuals and the overall team. And visionary thinking. Leaders must see the big picture, manage daily operations, and plan for the future, setting long-term goals and finding innovative solutions aligned with the organization's mission. As nurses developed their leadership skills, we started to ask, to what end? We knew that the United States faced major healthcare challenges, including in life expectancy, infant mortality, and maternal mortality. We spend the most on healthcare, but have little to show for it. Disparities in healthcare access and outcomes related to race, income, geography, and other social and environmental factors are also common. But we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and the most trusted segment of the healthcare workforce. They work in a range of settings, and they are often the first and most frequent healthcare contact with individuals, families, and communities. In 2019, the Robert Wood Johnson Foundation, my former employer, asked the National Academy of Medicine to chart a path for the nursing profession to reduce health inequities and improve the health and well-being of the nation. So again, another report that I helped to lead and execute. The report's vision is audacious: the achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. The report was released in 2021 and identifies 8 skills and competencies that all nurse leaders need to advance health equity. Nursing faculty and deans need to help more nurses to develop and expand these leadership competencies. In particular, we need more nurses who are comfortable leading multi-sector partnerships, including organizations outside of healthcare, such as community-based organizations that deal with food insecurity, transportation, housing, and social isolation. The American Organization for Nursing Leadership developed nurse leader core competencies to provide the framework for the knowledge, skills, and abilities associated with effective leadership. From first-time leaders to experienced executives, the overarching core competencies encompass the breadth and depth of the nursing leadership specialty across healthcare settings and leadership roles. So the big question is, what strategies are available to help nursing educators to start to develop these leadership core competencies in undergraduates? The American Association of Colleges of Nursing in 2021 released their AACN Essentials, and it's one of the best resources available for developing leadership competencies in undergraduates. These competencies are used to define quality in nursing education. They outline the necessary curriculum content and expected competencies of graduates of undergraduate nursing programs, as well as for advanced education. AACN provides resources and supports to schools. One of the Essentials 10 domains focuses on leadership development. AACN defines the development of the nurse as a leader proficient and asserting control, influence, and power in professional and personal contexts. The development of these dimensions requires a commitment to personal growth, sustained expansion of professional knowledge and expertise, and determined leadership practice in a variety of contexts. Faculty are tasked with developing the competencies listed on this slide and the next one. AACN provides many examples of how nursing faculty can develop these competencies in their classrooms, and I'm going to provide a few examples for you. This assignment gets nursing students involved in community health and policy solutions. Students work in teams to complete a community assessment on an issue. It could involve a certain population not going to follow-up appointments. The students could evaluate why they aren't going and come up with a solution. Another assignment enables students to read and reflect on what they feel are important characteristics and core values for a nursing leader. Then they create a personal list of characteristics and values that reflect essential elements of a nurse leader and put it in a word cloud that they can refer to while in school and in the workplace. The Future of Nursing report recommends schools of nursing better integrate content about the social and economic drivers of health, health inequities, and population health into all undergraduate education. Schools of nursing need to integrate these concepts and competencies throughout the coursework. It's much more than offering a population's health class. Schools should also expand community learning opportunities. Substantive education in the community, such as in schools, workplaces, home health care, public health clinics, and telework settings, allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Faculty and deans can partner with community organizations to help students understand the social determinants of health and gain the competencies to be able to promote health and prevention and to address health equity. Students can design health promotion programs for vulnerable communities. That work will prepare them to lead partnerships. As leaders think about implementing competencies, it's crucial to keep compassion in nursing front and center. And I speak from experience. In 2016, I lost my husband in a bicycle accident. Before he died, he spent 10 brutal days in the intensive care unit. His systems failed one by one, and on the 10th day, I made the most difficult decision of my life to remove him from life support. A staff nurse helped me to move my 6'4", 240-pound husband so that I could lie next to him. She stayed well beyond her shift to help me turn off my husband's machines. She also told me how beautiful the pictures were in the album that I kept beside the bed. You can see them on this slide. That nurse held me up when I could not stand, and she provided the compassion and the empathy that I so desperately needed at that time. She epitomized for me the empathy that I wish all clinicians possessed. There were few other clinicians who stood out for their compassion, but they were the exception. I came away from the experience shaken to the core. I had been a bedside nurse at one time, and in the years since, I spoke widely about how nurses have enormous potential to improve health and health care. I still believe that, but what I saw and experienced in the hospital was far different. My husband received excellent clinical care, but the compassion piece too often was missing. The ICU often seemed chaotic, and practitioners were too busy and preoccupied with the task at hand to provide the human touch I needed. I wanted practitioners to explain what was happening to Bob. I wanted them to look at me and address me when they came in to see him, and I wanted to feel consoled. I wanted them to understand that just hours and days ago, Bob was full of life and caring for his family. Instead, at times, I felt abandoned and on the defense. I learned that many clinicians did not have the time and sometimes even the inclination to provide the compassionate care needed by patients and their families. Technology, paperwork, staffing ratios, personal issues, and the work culture can overwhelm the best of clinicians. I know this. Far too often, clinicians asked if I had questions with their head already outside the door or from behind a computer. I was bereft, scared, and more alone than I'd ever been in my life, even when family and loved ones surrounded me. Ultimately, I asked to speak to someone to discuss Bob's overall well-being, including a prognosis and what my options were, something no one should ever have to ask. By sharing my story here with you today and in the book that I wrote, I hope that you will prioritize the importance of making compassion and clinical care a central part of every patient and family interaction and truly engage them in their care decisions and pass that along to students. Patients and their families deserve nothing less, especially as schools of nursing and health systems are busy integrating artificial intelligence. There will never ever be a replacement for the compassion exhibited by a nurse. It can make all the difference in healthcare and end-of-life outcomes. It did for me. There are many efficient nurses in the world, but it is my opinion that you can only be a great nurse if compassion is front and center in your practice. Florence Nightingale once said, "May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done." About a decade ago, I fulfilled a lifelong dream in traveling to the United Kingdom and Turkey to follow in Florence Nightingale's footsteps. I bought a replica of the lamp she carried. Her lamp has become my renewed symbol for how we as nurses might carry on her mantle of leadership, and I hope it will be your symbol as well. As teachers and leaders at schools of nursing, you have an opportunity to take up her mantle of leadership, to help mold and form the leaders of tomorrow, to promote health and prevention and advance health equity, and to role model and instill compassion. I can't wait to see what you and your students accomplish. Thank you for having me. Merci.
Comme ce matin, j'invite Christophe Debout à nous rejoindre pour une petite conclusion de 3 minutes.
Merci. Nous tenons encore à remercier le Dr HASSMILLER pour sa présentation. Donc, comme vous l'avez compris, et ça fait écho avec l'intervention de ce matin de la conseillère auprès de l'OMS, à la fois l'OMS et le Conseil international des infirmières incitent au développement du leadership infirmier partout dans le monde. Ils considèrent que c'est une condition à l'atteinte des objectifs de développement durable qui ont été définis par l'ONU et par l'atteinte de la couverture sanitaire universelle. Comme vous l'avez compris, au niveau national, les représentations de la France sont en train d'évoluer en matière de concept de leadership infirmier. C'est un concept qui doit être abordé dans notre contexte national de manière plus large. Leadership clinique, leadership managérial, mais aussi leadership professionnel doivent agir en synergie. Ils ne sont pas concurrents, mais bien complémentaires. On l'a vu à plusieurs reprises, notamment à la table ronde de ce matin. Nous ne manquons pas, comme vous l'avez compris, de littérature scientifique sur le sujet. Nous avons également énormément d'enseignements qui ont été dégagés des expériences étrangères similaires. Et donc, se former à l'exercice du leadership, ça débute dès la formation infirmière initiale. Et ça se complète tout au long du parcours de l'infirmière, en fonction de son projet professionnel, de son parcours, de ses opportunités. Et comme vous l'avez compris, ce sera un des défis également du futur référentiel de formation infirmière. Merci.
Merci.